Yesterday, the Ministry of Health reported 3,637 cases of COVID-19 infection in Singapore, with 3,039 cases in our community. I'll paint you a snapshot of our local COVID-19 situation so as to depict the context behind the changes that we are announcing today. About 3.5% of all unvaccinated local cases had a more severe illness requiring either oxygen supplementation, ICU care, and this contrasts with 0.6% of all vaccinated cases. Just over 17% of those who are infected with COVID-19 infection were people above the age of 60 years. Proportionately, more people who are older are hospitalized with severe infections, need oxygen supplementation, or need ICU care. And when I look further into the data of those who are infected above the age of 60 years, there is a proportion of those who are not fully vaccinated trending upwards, whilst those who are fully vaccinated, that proportion has correspondingly decreased over time. It's been said that COVID-19 is now an epidemic of the unvaccinated getting infected, getting severely ill, or even dying. This has been observed in other countries, and regrettably, it now appears to be the case also in Singapore. And if you remain unconvinced of this, I will highlight additional statistics, some of which have been shared previously by Minister Ong and myself at previous media conferences, but we have refreshed some of that data. The overall risk of infected COVID-19 patients who need oxygen supplementation, ICU care, or who have died is 8.1% of all unvaccinated people, and this compares to 1.4% for fully vaccinated people. This means there's a relative risk of 5.8 times more for an unvaccinated person to get a severe infection compared to vaccinated people. And if I only focus on those who were ever in ICU or those who had passed away, the relative risk for the unvaccinated persons is 10.4%. For those who have died from COVID-19 infection, the unvaccinated and infected persons had a relative risk of dying of 11.7% higher than that in vaccinated people. If we now consider that the older people also have a higher risk as a result of their age and chronic medical conditions of getting severe infections, needing ICU care, or even dying, those above the age of 80 years and were unvaccinated, that risk was 21.7% compared to 3% in the vaccinated group. The unvaccinated seniors above 80 years had then a 7.2 times relative risk higher than that of their vaccinated peers of needing ICU care or death. For the bigger group of seniors, again above the age of 80 years, who needed now not just ICU care, not just having a risk of dying, but say having oxygen supplementation needs, the risk in the unvaccinated group was 52.7% compared to 13% in the vaccinated group. And this is a relative risk of 4 times higher in the unvaccinated group. For those of you who believe that you are younger and so do not need to get vaccinated because your chance of getting severely ill or needing ICU care is low, you should note that those infected with COVID-19 and even between the ages of 60 and 69 years carries a higher risk of needing oxygen supplementation, ICU care, or dying. That risk is 27.8% if you're unvaccinated versus 2.1% if you're vaccinated. And that means you are 13 times more likely to have these requirements, needing higher care, needing ICU care, or even dying if you are not vaccinated. And if I only look at those who required ICU care or who passed away, you have a risk of 8.2% of getting into this situation if you're unvaccinated and only 0.3% if you're fully vaccinated. And in other words, you have a 27 times greater relative risk of needing ICU care or dying if you're aged between 60 and 69 years and unvaccinated compared to vaccinated people in the same age group. There are some who look at the figures and say that, well, the absolute numbers of those who have been vaccinated appear to be greater than the numbers who are unvaccinated and are in hospital. That is true. And this is because the total numbers of people who are vaccinated in Singapore is far greater than the remaining people who are unvaccinated. And therefore, even if that risk of getting infected, needing hospitalization among those who are vaccinated is low, in absolute numbers, that number may still be higher than the number of those who are unvaccinated and infected in hospital. But if you look at some figures, for example, if you look at the proportion of those who are unvaccinated and vaccinated in the ICU over the entire population, then you end up with numbers very similar to what I described earlier. 3 per 100,000 unvaccinated versus negligible numbers. When you round it off, it's almost 0 per 100,000 vaccinated being in that similar situation. So please don't be complacent and assume that your younger age sufficiently protects you from not needing vaccination. It doesn't, particularly if you have chronic medical conditions like diabetes, hypertension, heart disease, chronic lung conditions, cancer, or if you're immunocompromised, or if you're even obese. Tragically, we have seen people delaying vaccinations because they were complacent and thought they would not fall sick, only to find themselves not only infected, but also in the ICU. Others have thought that their beloved seniors were protected by staying at home and not needing vaccinations. The facts show otherwise. So if you're still remaining unvaccinated, I strongly urge you to step forward and get vaccinated now. We have made it easier for you to do so, and now also provide you with a greater choice of options with the PISA approval from HSA and the endorsement from our expert committee for COVID-19 vaccinations for the Sinovac vaccine. Today, about 68% of infected people are in our home recovery program, with another 4% in our community treatment facilities and 6% in the acute hospitals. And the remaining reside in community facilities because they are unable to safely isolate at home. Home recovery remains a safe default option for the majority of COVID-19 patients, and we will continue to monitor them who are recovering at home and support them with telemedicine services. And should they develop more severe symptoms or have life-threatening emergencies, the 995 emergency ambulance service will convey them to the hospitals for further care. We have expanded our telemedicine services and call center capabilities so as to better support the increasing number of well but infected COVID-19 cases who are on home recovery. And this means that it is easier now to access care while recovering at home. Many GPs have also indicated their willingness to continue supporting their patients with whom they have long-standing relationships. They remain another source for medical help for those on the home recovery program. Community-based pediatricians have also volunteered their time to support children who are recovering at home. And I wish to thank my primary care and community specialist colleagues for stepping forward to provide support and care. They join their colleagues in the hospitals and form part of our national effort to provide better care for COVID-19 cases. Yesterday, we had 1,609 patients with COVID-19 infection admitted into our acute hospitals. And of those hospitalized, the numbers of cases needing oxygen supplementation has stabilized over the past 5 days, with 338 cases needing oxygen support and 57 cases in the ICU needing that critical care to support their breathing and oxygen needs. There are many other patients in the ICU who are either COVID-19 cases who require additional treatment from the ICU healthcare teams beyond just treatment to support lung function, and also patients with non-COVID-19 life-threatening medical conditions who require that ICU care. And our overall ICU capacity remains sufficient for our present needs, and our overall ICU occupancy hovers between 72% and 78% in our public hospitals. We are mindful that the numbers of COVID-19 cases may increase quickly over a short space of time, and we have now taken additional steps to further increase our ICU capacity as a contingency. Our doctors and nurses in the hospital, and particularly in the ICUs, continue to work long hours and do their utmost to provide the best of care for their patients. We are working with the hospitals to mobilize additional support for them. We presently have more than 1,900 beds in our community treatment facilities with an occupancy of just under 50%. We appreciate our private hospitals and primary care groups who have stepped up to support the running of these facilities in partnership with our public hospitals. And we will continue to add further capacity to our CTFs in anticipation of more patients requiring care there over the next few months. Our expansion will see another 600 beds added before the end of October and a further 2,000 beds before the end of November. Coming back to vaccinations, as of the 21st of October, 84% of our population had completed their full vaccination regime and 85% had received at least one dose. I strongly urge all who have not vaccinated yet to step forward to do so. This is not only to reduce your risk of getting infected, but particularly of getting a severe infection or dying from COVID-19. So the announcements we make today regarding the PISA approval being granted to the Sinovac CoronaVac vaccine and the provisions we have made to make vaccinations more accessible will help to improve our overall vaccination coverage and facilitate our strategy to further protect our community against COVID-19. Thank you.
Thank you. Kenneth went to great length explaining the benefits of vaccination because, as many of you know, there has been, I think, a message going around saying that, wow, ICU beds 40% occupied by vaccinated individuals. So MOH come clean. You know, MOH have always been releasing as much data as we can. Data that we think will help the public understand the situation, understand the benefits of vaccination, including all the data that Kenneth just cited. But I think such selective quoting of data, 40% ICU occupied by vaccination, by vaccinated individuals, therefore vaccines don't work. I think this is selective use of data to mislead people, and it's a disservice to people. If we just, it's not about transparency of data, it's about the right application of math. As I said before, if the whole 100% of our population is vaccinated, every single ICU case, every single death case is vaccinated. It doesn't mean vaccines don't work. What you need to look at is the incidence rate. What is the base, you know? And a very stark piece of data is this. We have 1.5% of seniors, or rather we have a group of seniors that are still unvaccinated. They account for 1.5% or slightly less of the total population, and over the last 28 days account for 2/3 of ICU occupancy and deaths. And that's how stark it is. So do get yourself vaccinated and be careful of misleading WhatsApp messages and poor math.